Teen suicide is a serious issue that affects millions of people. A suicide affects more than just one person. It also affects the family and friends of the victim. Suicide prevention is an ongoing struggle to keep people from taking their own lives. This struggle takes place in many forms, one of which is to treat people with suicidal tendencies, those who show signs of wanting to take their own lives. These people are usually given therapy, antidepressants, or a combination of the two to get rid of their death wish. One of the leading causes of suicide is depression. Over 90% of people who commit suicide have depression, or another similar mental condition. Preventing depression is the first step towards preventing suicide. As for how to go about treating depression, the cure starts with the cause. There are many factors that contribute to depression, especially depression strong enough to cause people to consider suicide. But one factor common to almost all depression victims is an abnormally low level of serotonin. Serotonin is a neurotransmitter, a chemical in the brain that is responsible for certain behaviors and emotions. Serotonin is what calms people down and relaxes them when they are stressed or worried. Without it, one may feel that ordinary tasks are daunting, and problems at home or school seem bigger than they are. With nothing to help them put things in perspective, people with low serotonin levels feel the need to escape their problems with drugs, alcohol, and even suicide. Antidepressants are a category of drugs meant to treat depression by raising serotonin levels. With raised serotonin levels, patients no longer feel that their problems are as impassable as mountains, and gain the motivation to do more things for themselves, solving their own problems, and most importantly, not feeling the need to end their own lives to escape the pain. There is a common belief that antidepressants actually increase the risk of suicide in some young adults. In 2004, fear inspired by this belief prompted many to refuse antidepressants as a form of treatment, lowering the overall number of antidepressants being prescribed to youths in the United States. However, the following year, the rate of suicide in United States youths went up by 14%. Around the same time in Sweden, antidepressants were being prescribed at a higher rate than usual, and the suicide rate there went down by 19%. What does this mean? Well, while there may still be a lot of research that seems to indicate that antidepressants increase the likeliness of suicide in teens, much of that research measured the percent of youths showing suicidal behavior, and not the number that actually committed suicide. It's hard to be sure whether the teens exhibiting suicidal behavior would have actually committed suicide in the end. There are many different brands of antidepressants, and they all work a little bit differently. There are three broad classes of antidepressants: monoamine oxidase inhibitors, also known as MAOIs, tricyclics, or TCAs, and selective serotonin reuptake inhibitors, also known as SSRIs. These three classes target different areas of the brain and different neurotransmitters, but even within one class of antidepressants, there are many different options for treatment. Some people may give up after finding that one antidepressant doesn't work very well for them, when a different brand could have helped them.
Teen suicide often occurs because the teen feels like no one understands them, which makes therapy a great option for teens who feel alone or misunderstood. Therapy also offers many options such as cognitive therapy, which is a one-on-one behavioral kind of therapy. The whole theory behind cognitive therapy is that your thoughts affect your emotions, which affect your behavior. And then there's group therapy, which is another great option because teens feel like there's other kids with similar problems, and they can hear and see other kids going through the same thing, and it comforts them to see that there are others like them. Therapy is better than drugs, mainly because therapy is permanent. I say this because therapy you go into as a depressed person, a person who felt like you've been beat down by the world, and you come in depressed and suicidal, and you walk out a totally changed person, and you did it yourself. Drugs are artificial. Medicine used to cure suicidal thoughts is a joke, because they don't stay forever. You have to use that pill. Therapy, you went in there and you changed yourself. Yes, you had help with a counselor group, but you changed yourself. And that's something drugs can't do for you. They won't change you forever. They'll change you as long as you're taking that pill. And that's what people need to realize, is that therapy is the way to go if they're looking for a permanent cure, per se, for suicidal thoughts. The goal of cognitive therapy is to make suicidal people think not so negatively. So basically, cognitive therapy makes people who think negative thoughts about a situation and turn them into positive thoughts. Like, for example, if you went into work and you said, hey, like, to your boss, and they didn't respond, was it a suicidal person would think, oh, they don't like me, the world's gonna end, like, I'm gonna lose my job, or something along that nature. Very negative thoughts. But they didn't think for like a moment even that maybe their boss just didn't hear them, or the boss was busy. They didn't think about any of those kind of more positive thoughts. Like, it might not be that they hate you, you know? You gotta think through that. You can't. So basically, cognitive therapy is the second most popular way of therapy for suicidal people is group therapy. Group therapy gives teens this comfort that there are other people just like them. It's just like any kind of situation at school or anywhere. You like to be with people who have similar feelings about issues or similar views on things, you know, similar likes and dislikes. Well, group therapy is people with similar problems, and these teens feel are comforted when they see other people with equal or worse problems. They see that they're not the only ones experiencing these horrible thoughts, and it's usually effective, and it has a big impact on them to see that other situations that are worse, you know, it, like, they get thoughts like, well, maybe my life isn't as bad as I claim, like, say it is. Maybe I don't want to kill myself. Maybe I should appreciate what's good, you know, like, that's what group therapy gives them, is this comfort that other people have worse problems, and if it works, it convinces them that their problems aren't as bad as they think. The struggle to prevent suicide often goes beyond the treatment of individuals. There is also an ongoing effort to change the way our society views suicide. There are many common beliefs about suicide that discourage people from taking action and potentially saving lives. Beliefs like a threat to commit suicide is just a plea for attention, or there's no chance that anybody I know is suicidal. The truth is, many people who say they want to commit suicide do plan to carry it out. Making fun of somebody who claims to be contemplating suicide is the worst thing you can do. Any threat of suicide or any unusual behavior that could be a sign of suicide should be taken seriously. Many people may be reluctant to get help because they believe seeing a therapist or taking drugs means there's something wrong with them. That's why it's important to talk to friends and family if you think they may be contemplating suicide. Preventing suicide is a community effort. Everybody has to pitch in and support others in their times of need. Thank you.